So today in emergency medicine, we are going to talk about stroke. So this is also very common and most important and life-threatening disease after a heart attack. Okay. So basically, we talked about cardiovascular stroke or cardiovascular attack and septic shock or sepsis. And now we will talk about stroke. So basically, what is stroke? Stroke basically is a sudden onset of neurological defect due to the vascular mechanism. Here, very good and very small definition given. Neurological defect due to the vascular mechanism. Vasculars means arteries, veins, neurological nerves, brain, spinal cord, only brain here, central nervous system. Okay, that is brain. Okay, so here brain is affected. The function of the brain is affected due to the vascular mechanism. Okay, vascular mechanism, vessels, arteries, veins. So basically here 100%, 85% we can see that the ischemic stroke means in the arteries there is blockage. So the blood supply to the brain is reduced or completely stopped. So there's the reason the area of the brain cannot be function. So what will happen? The brain will not get oxygen, proper oxygen and proper glucose or nutrition. So the brain cells die. So it may be permanently, it may be temporary or sometime. Okay. So that the first type of the stroke is ischemic stroke. So this is the most common. Ischemic mean the blockage in the arteries. Okay. And the second type of most common is hemorrhagic stroke. Hemorrhagic means due to the intracranial pressure, the pressure in the brain is increased through any accident, through BP or multiple reasons we will discuss here. One most common reason that is increase in the BP, raised in the BP. So BP raised. So what will happen in the brain? We have small arteries, arterioles. Okay, so arterioles, what happen? They break down and the blood comes out from the arteries to the brain. So the brain have affected with the leakage of the blood. So it will compress the brain. What will happen? We can see the neurological defect. Okay, this is the most common. Okay, so what will happen that and mostly in the sometimes what will happen, we have one type of ischemic attack, means blockage in the blood that is minimal uh, stroke or minimal blockage in the arteries, so which have some patient have some symptoms, then afterwards what will happen, it will vanish. Okay, for 5 to 15 minutes. Okay, so due to the stroke, we have this is the old report according to the Harrison, that due to the stroke in the United USA, 150,000 deaths occurs in a year. So this is also very most common cause of the death after heart attack. Okay, so what can do during the stroke? Let's talk about what are the pathophysiology, clinical features are there. Okay, so where mostly the stroke occurs in the brain. Basically, we will not go in the detail because we want to focus on the emergency part only. Okay, so what happened in ischemic stroke? Ischemic stroke can be due to the embolical occlusion of large cerebral vessels. So what are the vessels in the brain? So in that we have blockage. Okay, where it comes from? where it how it happens, we will discuss in CNS. But here only blockage occurs. So what will happen? This, if this is the brain part, so the blood supply to the brain part will be reduced or not to be. It will reach to the brain. Okay. So this due to due to this problem, what will happen? The brain area will die. Okay. So here, what are the symptoms? You can see that. Okay. In the ischemic stroke. Okay. So if the problem, if the it is depend upon purely on the area, which area of the brain is affected. If it is affected motor area, the person's hand and leg will become. If it is damaged more, hemiplegia, damage is less, hemiparesis. Hemiparesis is chances of getting cured are more. Hemiplegia is completely weakness, zero power. We have we have to check the power of the limbs whenever a patient come of the stroke. So you have to check with 0 to 5 power. So mostly hemiplegia is 0 power, unable to lift the hand, complete damage of the motor nerves. Some patient will have unable to talk, they have slurred speech, the speech is not completely calm. It's affected the speech area of the brain. Some patient have respiratory distress. Okay, it affected small brain. Okay, some patient have cerebellar ischemic stroke. The patient will have different in walking, unable to balance. Okay, so these are the areas which you can see that the different areas have different symptoms. So whenever patient come, we have to ask which thing come first and what happened, what are the symptoms are seen in the home. Okay, some will have blindness. Okay, so these are the different types of symptoms. I already told you different local areas have different symptoms. Cerebral hemisphere. Okay, this type of symptoms can be seen. Hemiparesis. Okay, sensory defect, and patient have speech difficulty. Okay, these are the things you can see. If it is my medial aspect, in the medial aspect, okay, paralysis of foot, leg, okay, mostly loss over leg. Okay, reflexes are decreased, urine incontinence, continence. Okay, unable to go or unable to follow the urine, or urine will come out without his sensation. Different gained apraxia, difficulty in walking, cerebral hemisphere posterior effect. Okay, these are the things you can see. Different part of the brain have different symptoms. Okay, here we have the intracranial hemorrhage. Next is ischemic. First is ischemic stroke, and second one is hemorrhagic stroke, bleeding in the brain due to the rupture of the arteries. Okay, so what will happen in this condition? The most important thing you have to see the BP. So his BP is higher than, very higher than normal range. Minimum 200, above 200, 220, 240. Some patients will have about 200. You can see that. Okay. Yeah, in the hemorrhage, hemorrhagic stroke will occurs mostly due to the head trauma accidents. Okay. Accident or a BP, hypertension. Okay. Or else sometimes first ischemic stroke occurs. Then what will happen? Hemorrhagic stroke, it converted into hemorrhagic stroke. Okay. It will happen, or any tumor in the brain. Okay. Or using any anti blood thinners. Okay. It may be happen. Okay. due to the cardiac problem or different types we have. But in all these things, you can see that you have to get that his BP is higher side, and he have damaged the arteries. The arteries are ruptured and it damaged the some part of the brain. Sometimes it needed surgical intervention. Okay. So understood till here or any doubt? What is here? Uh, Here we have to see about the treatment. So basically, it is emergency condition. So you have to take to the hospital, nearby hospital. Mostly 3 to 5 days are very important. Okay. So you have to distinguish between a stroke and other things. It is only done by scan. Okay. A radiologist scan, you have to do CT scan or MRI scan to differentiate hemorrhagic stroke or ischemic stroke. Basically, you can do CT first. If it is not hemorrhagic stroke, you can start ischemic stroke treatment. It is depend upon the radiological imaging. Okay. So doctor will decide, neurologist will decide what type of treatment the person need. But we have to know these two types of diseases are there. So what are the conditions will happen in the emergency and what type of treatment we need. First, what happened whenever a patient came to they will follow this mostly. Okay. But some hospitals have their own protocol. They will make the protocol and they will attach that uh, in their hospitals, and they will follow, every doctor will follow during the emergency condition. Then afterward, one of the neurologists will decide what to be go further in emergency medicine also. First, patient has stroke, then you have to check the glucose level. Sometimes what will happen, hypoglycemia will also cause stroke-like symptoms. Okay. So in that condition, you have to check if the patient is diabetes. Mostly you have to check the glucose levels. Okay. If the glucose is less, then you have to start give glucose support. It may be orally, it may be IV. Sometimes it may IV, the patient need IV. But if the glucose is normal, then you have to go to the brain imaging. So you have to see the symptoms. First is uh, deviation of mouth. You have to see that. And slurred speech disturbance is 100%, mostly 99% related to the brain. And you have to see the uh, facial deviation or facial paralysis also, and numbness or difficulty in walking. These are the things you have to see. The patient will have a headache, severe headache. When you check the BP, you get that 200, above 200, or above 180. So there is the emergency condition. The patient need emergency treatment. So first, what you have to do, you have to do the brain imaging. So in that you will get it, either it is ischemic stroke or hemorrhagic stroke. In that 85% are ischemic stroke. If so 100% are there, mostly 70 to 80% are ischemic stroke. The other 15% are hemorrhagic stroke. So what they do, if the ischemic stroke is there, they will start anti platelet therapy. Some will give embolic. Uh, some will start anti-platelet therapy. Okay. Thrombosis will do, means thrombolysis will do. They will give the emergency medicine within 4 to 6 hours. I think so. It is depend upon the neurologist, so which will remove the clots in the brain rapidly. So it will regain the uh, power what the patient has lost. But sometimes what will happen, if there is blockage, you are trying to reduce the blockage to improve the blood circulation. In that process, sometimes the weakened artery will rupture, and the patient will have high BP, hemorrhagic stroke. It will convert into hemorrhagic stroke. Some patients I saw, they will have the ischemic stroke, thrombolysis done, then he will enter the hemorrhagic stroke. Okay. So here, hemorrhagic stroke, you have to check the BP and what are the causes of the BP, what are the causes of ischemic stroke, you have to see. There is maybe chance of if from the heart, the clot gone to the brain, it may be reason, or the carotid arteries are there, is the problem in the carotid arteries. So you have to check, or other reasons like lipid things, lipid, mostly fatty acids are high in the body. Okay, you have to check other reason. Okay, so you have to establish all the things. Here, what are the cause? Maybe aneurysm, damage, direct hypertension due to prolonged hypertension, not on medications. Medications are there, but it is not working, and sometimes 4% other reasons are there. So they will start accounting to the reason and they will treat the patient. Okay. So basically, CT brain or MRI, it is the first choice of imaging in the then they will decide is there uh, ischemic stroke or hemorrhagic stroke. So I think you understood about that. So these are the things are there other than they're not in emergency, acute. Okay, but I will discuss in CNS topic. But here in emergency condition, what the patient will have and what condition is there, how to understand the scenario is we are going to understand. We are understanding here. Okay, so I hope you understood about that. What is stroke? How many types of strokes? What are the differentiate between strokes and what doctors do in initial condition? Okay, so this is all about stroke. Any doubts, please ask.